With 2 months to go in the enrollment period, about 9 million people have signed up for HealthCare under the Affordable Care Act. More than 33,000 Oklahomans have completed applications for insurance through the new law, applications that will provide insurance for more than 51,000 people. About 600,000 Oklahomans have had no health insurance. Those involved in helping people sign up for health insurance predict the numbers will increase dramatically as the March 31st Obamacare enrollment deadline approaches.
For the last month, an Edmond church has been holding classes once a week to explain the facts of the Affordable Care Act and helping people sign up for health insurance. But simply holding the class, with the help of an outreach person from the Oklahoma Primary Care Association, has been controversial.
I know this class has caused some anxiety in our church because it has been deemed as political, and it was never meant to be political. It was meant to be informational.
Vicki Toombs is an active member of the First United Methodist Church of Edmond and organized the class, which is one of many the church has on numerous topics. But none has caused the stir this one has. Toombs works in the health insurance industry, selling coverage to large companies. She says from an agent's perspective, the ACA has been very disruptive because of all the changes and difficulty in keeping up with the regulations. As an individual, she sees the ACA quite differently.
In our church, we like to believe and teach that all people matter. That thought just stays with me constantly. All people matter. And if all people matter, then all people need to be covered. All people need to be as healthy as they can possibly be.
Don Vaught is Minister of Biblical Studies and Discipleship at First United Methodist of Edmond. He says despite the beliefs of some, the Wednesday night class has been non-political.
And what we're trying to do is help people make healthy decisions. We wanted them to be informed as opposed to be ignorant. And so we thought it was important, since this has been the law of the land since 2010, that we reach out, help them learn the law.
And for those who have attended, the information has changed their lives.
All the stories you hear, I'm amazed at the misinformation in the state that's being spread about the Obamacare or the Affordable Care Act.
Because of pre-existing medical conditions, John Marshall and his wife found health care unaffordable.
Yeah, I have diabetes. My wife's a cancer survivor. We have a real hard time getting insurance. The plans that we were looking at were junk.
The best plan John could find was a $5,000 cap and cost him 3 times what he's now paying under the Affordable Care Act.
Well, you would not believe the amount of stress you have. Someone that has pre-existing conditions, my wife, we never know if that cancer is going to come back, what kind of expense we're going to be faced. We could be wiped out. This way we know we're safe. We can live a life and enjoy ourselves just a little bit now.
Life changed for Laura Hester and her 19-year-old son Tanner 18 months ago, leaving them without health insurance for the first time. Again, because of pre-existing conditions, insurance just for her son would have been more than $200 a month.
It's something we weren't going to be able to do this month or this year. And you know, he's an athlete, so he is. We were always really worried about him getting hurt.
And Tanner has already injured himself playing sports.
Yeah, I've broken it and rolled it and sprained it a couple times.
Laura is in the process of signing up for health care under the Affordable Care Act, and because of the tax credits, she can afford it for herself and her son.
It will fit amazing. The credits, it's going to end up being like $34 for just him and I.
Even 19-year-old Tanner can appreciate having insurance.
And there's a lot more security in it. If I'm at my sport and I hurt myself or my ankle, I'm not worried about going home for a week and hoping it's not broken, you know.
21 miles south of the church in Edmond is the Riverside neighborhood of South Oklahoma City. That's where the Latino Community Development Agency provides navigators who are signing people up for the ACA 4 at a time every hour of the working day, 6 days a week. Ruben Aragon is president and CEO of the agency, and he says the demand for enrollment is increasing.
We've seen better than 4,000 and given them a lot of education. A lot of them sign up when they're here. A lot of them take all the information and then think about the decision and sign up directly.
The agency is also reaching more than just central Oklahoma's Hispanic community.
We do this in English, we do it in Spanish, we do it in Vietnamese. So we have, we're one of the sites that has the most multicultural, multi-language sites here.
Aragon says of the estimated 600,000 plus Oklahomans who have no health insurance, a big percentage of them are Latino.
39% of Latinos have no health insurance at all, since they don't have a lot of the employer-funded health insurance. It's the largest uninsured group in Oklahoma.
But even after all those who can sign up for health coverage in the Hispanic community have done so, a large number of uninsured will remain.
It's a real shame that the Affordable Care Act excludes a lot of the undocumented, because if the undocumented were allowed to sign up, it would drive cost way down for most Americans, because most of the undocumented are younger. They're exactly the kind of people you'd want in the insurance pool.
Aragon says the Latino agency is seeing the immediate impact of Oklahoma's decision not to expand Medicaid.
What they get instead is exemption from any penalties, because they would have qualified, so they have penalties, but they walk out without any insurance.
The politics surrounding the health insurance law have not been an issue at the Latino Community Development Agency, and despite some opposition at the church in Edmond, Vicki Toombs says the class there has been a success, reaching many more people than just those from the church. Toombs sees value in more classes like theirs.
There is going to be a need in the community for our church to continue to be, and all churches that are willing to be, a resource for their community, a trusted, secure place where they can go and say, can you help me with this?
Toombs says misconceptions about the Affordable Care Act generally fade away as people learn how the system works and what's available.
I've talked to a number of individuals, people that have gotten laid off at some of our, finer companies here in Oklahoma City, laid off from their employment, and now they're looking for health care and are just frightened, really, really frightened about what the future holds. They've heard all these horror stories.
The outreach coordinator for the Oklahoma Primary Care Association made clear to the group that what someone pays for health coverage under the ACA depends no longer on your health, but instead where you live, how much money you make, and what kind of plan you select. So for some, it is possible it will cost more for health insurance. Even with all the variables, Vicki Toombs has found joy in helping others finally get access to health care.
It gives me the strength that I need to keep doing this when the opposition is great.
The Oklahoma Primary Care Association estimates it has provided information to more than 10,000 Oklahomans about the Patient Protection Affordable Care Act, and all anyone in Oklahoma has to do to get that information or find a navigator near them is call 211 and ask.